Now this video segment relates to post-surgical complication. This young gentleman had a renal stone removed by surgical intervention, and presently you can see that the kidney is measuring 9.1 centimeter in length and 4.5 centimeter in anterior-posterior diameter, which is within normal. Then the other thing to note in this is the calculus with posterior shadow. It's giving posterior shadow and is in the region of the renal pelvis. Third thing to note is the brightness of the cortex. This is the cortex, and its brightness is increased significantly, though thickness is preserved, measures 6.9 at the mid region. And the fourth point is to note the degree of prominence of these pyramids. You hardly see pyramids dilated to this extent. This is the medulla, and this is the medullary pyramid. So the cortico-medullary distinction is intact, though the cortical echogenicity is raised. This one at the upper mid region, I have measured that. This is the upper pole, this is the lower pole, this is the mid region with calculus in the renal pelvis. Now the fifth thing to note is that there is no central sinus echo complex seen, because the stones they lodge in this area of central sinus echo complex. If you see the normal kidney, and this is the area of central sinus echo complex, which is not seen in this case. So these are the findings. Number one, the echo brightness of the cortex is raised. Number two, the pyramids are significantly dilated. Number three, the central sinus echo complex is not seen, is absent. Number four, there is a calculus in the renal pelvic region giving sharp posterior shadow. And hardly will come across, and very rarely we see so prominent pyramids. These should not be confused with the central sinus echo complex dilation of the collecting system, because the collecting system is in the center of the kidney, and the central sinus echo complex is also in the center of the kidney. So these are in fact and these also should not be, these areas, cystic areas, should not be confused with simple renal cysts. These are medulla, prominence of the medulla. Here is the calculus, this with posterior shadow. So we don't see any there is no dilation of the proximal ureter. This is the ureter, and proximal ureter measures 3.9, up to 7 is normal, so the proximal ureter is not dilated. This is the story of a young man, right kidney, after being operated for a calculus. The calculus was removed, and now while they are pyramids, see, you can see a bright tiny echogenic area anterior to this cystic area. These are the arcuate vessels, and they are seen at the anterior surface of the pyramids. So now there is another calculus seen in the lower pole region. This is another calculus that measures 8.6 millimeters in a kidney that shows muffled central sinus echo complex, no hydronephrosis. Now you see, let's see this kidney in transfer section. लंबा साल है क्या सारा? ये लंबा साल है. Okay. This is a magnified view coming to the normal of this kidney, longitudinal and now transverse. You see the dilation of the pyramids and note the degree of dilation of the pyramids. And here in the renal pelvic region, in transverse section, you can see a calculus. This is the longitudinal section with the calculus in the pelvis region, and the other was seen in the throat pole of the kidney. So this is kidney post-op, showing parenchymal changes, muffled central sinus echo complex, significantly dilated renal pyramids in all regions. These are pyramids, these are pyramids, this is a pyramid. So this is a study of globally increased cortical echogenicity, prominent pyramids with loss of central sinus echo complex.